Good afternoon, everyone. This is Kim Beer. I'm the Director of Public Policy at the Reeve Foundation. We'll get started in just a few minutes to let some of our attendees continue to log in. And thank you to those who've already logged in. Great, why don't we get started? Good afternoon or good morning to wherever anyone is dialing in from today. Again, my name is Kim Beer. I'm the Director of Public Policy at the Reeve Foundation. It is my pleasure to welcome all of you to our last webinar for this year. We are thrilled to present hopefully some last minute actions Congress we hope will take this month, but also some of our really extraordinary contributions and accomplishments this year. And I really want to send my sincerest thanks and gratitude to everyone who has been working with us diligently throughout the year. I also see some new names, and we're thrilled to welcome you to our advocacy program and to our army of advocates around the country who are helping us improve the lives of people living with disabilities. So why don't we just review a little bit about the agenda and we'll get started. We'll have introductions and welcome. We'll talk some congressional updates. And Chris, my colleague, will go into our grassroots updates, and then we'll have an opportunity for Q&A. And I know that some of the attendees, registrants, have submitted questions, and I will do my best to address them throughout the webinar, if not at the end. And please feel free to add your question into the Q&A box, and I will be managing that as well. Once again, we have our wonderful colleagues from Waxman Strategies joining us today, Celicia Lomax and John Sawyer, and as well, and of course, Chris Carson, who you all know very, very well, who is our policy and advocacy coordinator at the Reeve Foundation. I want to first start by acknowledging the recent passing of a champion of disability rights, Senator Bob Dole, who was a Republican senator from Kansas, having served twice as a majority leader between 1969 and 1996. He suffered wounds and an injury that would lead to paralysis of his right arm, and he dedicated many years of his public service to improving the lives of people with disabilities, and served as an integral part of the passing and working with Democrats across the aisle to write and pass the American with Disabilities Act. So I wanted to take just a minute to acknowledge his contributions, his passing, and the work that he really did to help improve the lives for all of us. So I think now I'll pass it over to Celicia, my colleague from Waxman Strategies. Celicia?
Yes, thank you, Kim, so much for that. And welcome again to everyone. Thanks for joining us. I'm going to start us off with some of the congressional updates and pass it over to my colleague John to talk a little bit more about what's going on. Want to start off with the Build Back Better legislation. For many of those who may already know, back in November, the House had very narrowly passed the Build Back Better bill at about $1.7 trillion. And mostly on a party line vote of 220 to 213, which took quite some time, as there were a number of weeks of negotiations and having to push the dates back in order to get the votes for this Build Back Better legislation. It is now with the Senate, where of course Democrats have the slimmest majority to potentially get it passed. One of the challenges there is also this timeline. So the Senate Majority Leader, Chuck Schumer, would actually like to see this bill voted on and finished by Christmas, so before the end of the year. However, there are a number of disagreements among Democrats, including, of course, Senators Manchin and Sinema on the provisions within the bill. There's also some disappointment among other Democrats on the language within the bill. And so the challenge here is that this could very likely slip into the new year, unfortunately, due to some of these disagreements, and also with this being an incredibly busy time in the legislative calendar. People may have also seen that there's other pieces around government funding that Congress has been working on, and a number of other areas and bills too that they are trying to work on. So there are very serious concerns about the possibility of this legislation passing before the end of the year, but we'll of course keep very close eyes on that, and hope that we could maybe see something before the end of the year. But if not, it may happen closer to January. So just to talk a little bit more about what right now is in this Build Back Better legislation, there of course is likely to be some of these items subject to change, but right now there's universal pre-K that's still in there. There's childcare subsidies. There's extensions of the Affordable Care Act benefits and including Medicare benefits as well. Paid leave has been a point of contention, but looks like there right now is 4 weeks of paid leave in there. This is a significant decline, I think, from a larger number of closer to 12 weeks of paid leave. There's climate provisions and tax changes as well. One of the really important pieces specifically for the Reeve Foundation is the Medicaid Home and Community-Based Services, which now has a $150 billion investment. This is a significant decrease from the original text that had $400 billion for HCBS. So this is slightly disappointing to see that this number has decreased, but it is still important that it's in there. And so one of the things that's particularly important for the Reeve Foundation is to continue advocating, of course, for the entire bill, but particularly on this portion around the Medicaid Home and Community-Based Services. So that's the big piece there on reconciliation. I'll pass it over to my colleague John to talk a little bit more about appropriations and government spending and the other aspects of the congressional updates.
Thank you so much, Celicia. And before I go on to appropriations, I just want to underscore a couple of the things that you said about the context of the Build Back Better legislation. And the first thing to say is this is an extremely ambitious and large piece of legislation that really spans across a whole lot of different domains, everything from all the healthcare sort of related pieces that Celicia mentioned, but as she said, to taxes, there's agriculture components, there's criminal justice components, there's transportation and infrastructure components. And so one of the things about Congress as it currently is structured is they use these large bills in order to get the biggest things done, in part because it allows them, using this process we call budget reconciliation, to pass things through the Senate with a simple majority vote, as opposed to the 60 votes that are needed to overcome a filibuster on most legislation. So, I think those of you who've been on these monthly webinars all year, and thank you to all of you who have been tracking this ever since it was sort of a proposal coming out of the Biden administration. Both Celicia and I work for a former member of Congress, Henry Waxman, who often will talk about how long it takes to really get major legislation done. And while I'm hopeful, and I think we're continuing to work towards seeing these provisions enacted by the end of the year, in some ways, given the breadth and scope of that bill, I think it's no surprise that we're right up against that deadline and potentially going into next year. I think the only other thing I would say is that the consequences of going into next year aren't, they're not procedural. It's not as though you have to start over as you would if there were a new Congress, which will happen the year after next. But they're more political in the sense that the closer you get to 2022 midterm elections, the conventional wisdom is the harder it is to pass major legislation as people see, their voters and the elections coming. So I think for those who are advocating for this legislation, the delay is concerning, but not, the death knell by any means. Just wanted to add those pieces, but I really appreciate Celicia, great job with the summary. So in parallel to that, that whole process, what has also been going on is the annual funding process for the entire federal government, which is known as the appropriations process. And that process happens, as I said, on an every year basis. It's sort of running in parallel to this conversation around the Build Back Better legislation. And that is the process where, starting with the administration's request and then through the House and then through the Senate, the Congress puts together basically the funding priorities of the entire government down to the program by program level. So agencies, sub-agencies, down to the actual line items of each program. The one of those line items that we at the Reeve Foundation pay the closest attention to is the Paralysis Resource Center. It's not the only thing we follow. We follow a lot of different parts of the appropriations process, including around biomedical research at the NIH, or including around programs at the Department of Defense and the VA. But the PRC is a federal program operated by the Reeve Foundation, but funded every year by Congress. And I think the exciting news is with real bipartisan support, both the House and the Senate in their draft FY22 appropriations bills contain increases in funding for the Paralysis Resource Center. Specifically, the Senate includes a higher total for the National Paralysis Resource Center specifically, that's operated by the Reeve Foundation, which would be an increase of $1 million. That's the very good news. Both House and Senate have weighed in. Both are supportive of the program, really supportive of the work that it does, and have called for an increased investment in that work. The challenge is now, on a much bigger picture level, Congress needs to finish its work. So Congress has officially the federal fiscal year 22, for which this funding should be taking effect, started back on October 1st. And in fact, Congress hasn't passed their final appropriations bill on time, in time for the beginning of the fiscal year, in I think more than 20 years. So they are currently operating as they typically do under what's called a continuing resolution. Basically, that puts government funding for almost every program on autopilot, and continues funding at the previous year's levels. The current continuing resolution goes until February 18th, and there's a number of issues, I think, standing in the way of the final deal. So we can talk a little bit more on the next slide about sort of where we go from there. As we said, the first continuing resolution was scheduled to run through December 3rd. Basically, on the eve of December 3rd, they passed another additional slightly more than 2-month stopgap continuing resolution until February 18th. And I think when it comes to what will happen then, the real question is, Congress has a number of different options, right? So they can do one of basically 3 things. They can pass another continuing resolution in February, where they extend government funding at current levels for another, say, month or two. they can finalize fiscal year 2022 appropriations, where these increases for the PRC and changes to funding for other programs would take effect. Or they can pass a year-long continuing resolution that basically says, we don't think we're going to get this done even by October 1st. And so we're just going to put everything on autopilot for the rest of the fiscal year. There is a fourth option, which has happened a handful of times over the last number of years, where they don't even pass a short-term continuing resolution, at which point we have a government shutdown, the way we've seen, again, a few times in the last few years. I think for those of us who pay close attention to this process, the hope, and I think probably our prediction, is that they will be able to finalize FY22 appropriations by that February 18th deadline. All parties have a stake in wanting to make sure that appropriations is finished, that it's not just done on sort of a across the board extension kind of way. And so, the incentives are there, but it's not a great sign that they have punted again until February. So we're keeping a close eye on that. I'm sure that in the coming year, and Chris will speak to this, we'll be activating the grassroots and asking you to weigh in with your members of Congress to get those increases, not just for the PRC, but for other key programs across the finish line. The other thing that I just wanted to mention briefly is that in the middle of all of this, there is also the recurring issue of raising the nation's statutory debt limit. Without going too far into all the weediness of this issue, what's important to know is that Congress sets a cap on how much debt the federal government can incur. And if the federal government exceeds that cap and Congress doesn't change the cap, the US is at risk of going into default on some of the national debt, which would, according to most experts, have major global economic negative consequences. The current debt limit extension is thought to be coming due around December 15th. It's not a specific date and time the way that legislative deadlines are. And that's because it has more to do with when the incoming revenues to the government and the outgoing expenditures. And so the Treasury Secretary Janet Yellen has marked the 15th as a date by which the Congress needs to act. There is still disagreement about how to pass this debt limit increase. I will say just in the last 24 hours, there's been a little bit of movement on this, and it looks like there's a path forward to once again raise the debt limit. It probably will go through with only Democratic votes, but essentially with Republicans in the Senate stepping out of the way in order to allow that increase to go forward with minimal debate or minimal amendment or changes. I think that the thing to know about the debt limit is what it creates in the congressional process is a recurring deadline that by which Congress needs to act. And sometimes deadlines are the only thing that motivates Congress to act in a final way. It does not necessarily free up any new additional money for new spending. What it really is the limit on spending that's actually taking place based on legislation that's passed in the past for both program spending and tax revenue. So I think that's just adding to the dynamics in Washington of a busy December, which I think we'll talk about on the next slide. So we thought it would be helpful, with this being the last webinar of the year, just to look back a little bit at what has been an incredibly, I think, eventful year in Washington, D.C., both overall in American politics and American government, but I think specifically also wanted to highlight some of the things that have happened with regard to the priorities of the Reeve Foundation and our community. So, obviously the first thing here, the inauguration of President Biden, Vice President Harris on January 20th, Obviously, before that, the year started in a really challenging way with the insurrection on January 6th, which has in some ways set the tone for a really contentious year in Congress. And I think part of why we think it's important to go back and look at all the things that have happened this year is, even though the rhetoric in Congress is and in politics is so contentious and so divisive, there actually have been a lot of things accomplished. And we want to highlight some of those things. So the first is that the American Rescue Plan Act was signed into law just months after the new administration took office. That's a $1.9 trillion investment, both in fighting the coronavirus pandemic with every tool of vaccines, testing, surveillance, et cetera, but also in some of the economic recovery measures that were needed in the wake of the pandemic to really start turning things around economically. Going into the spring and summer, as we have in the past, the Reeve Foundation worked with bipartisan champions in the House to circulate a letter in support of the Paralysis Resource Center. That got a number of bipartisan signatures thanks to work of advocates around the country, and really helped set us up for what we described a couple of slides ago around the appropriations increase for the Paralysis Resource Center. One thing I think we've mentioned on a past webinar, but just to remind folks, a good friend of the foundation, Anjali Forber-Pratt, Dr. Anjali Forber-Pratt, was named by the Biden administration as the new director of NIDLR, the new National Institute on Disability, Independent Living, Rehabilitation and Research, excuse me. That's just been a really exciting development. NIDLR is part of ACL, the agency overall that funds the Paralysis Resource Center and operates it in partnership with the Reeve Foundation. And Dr. Forber-Pratt has been a real leader, I think, in the administration on disability issues more broadly. Interestingly, she joined Doug Emhoff, the second gentleman, in going to the Paralympics this year, or at least in advising him, and did some events around the Paralympics as a former Paralympian herself. So as the summer went on, we saw both the House and then the Senate release the language calling for the increase in funding for the Paralysis Resource Center. We also saw that another piece of legislation separate from the rescue plan and separate from the Build Back Better Act, which was the bipartisan infrastructure legislation of almost $1 trillion in investments in highways, roads, bridges, airports, transportation, other hard infrastructure, electrification. That was signed into law this fall after passing with a bipartisan majority. And then, as Celicia mentioned, the House has now passed the Build Back Better Act. That's with the Senate. We talked about the government funding expiration, and there are many, many other things that aren't on this list, but as you can see, these lists always have a pretty big pileup as you get to the end of the year, and this year is no exception, with really just a week or two left of working days in this Congress. There's still an enormous amount of stuff that Congress needs to do. And so we will be tracking and keeping advocates up to date on all of that as it plays out. I think that's the end of my section, and I will turn it over to Chris to talk about a little bit more detail about how we'll be reaching out and what we've been able to accomplish this year.
Chris, before you start, may I just ask, I just saw one question in the Q&A and I thought it might be a good time if John could answer it now. Would you mind just reminding everyone what the Reeve Foundation was requesting for the PRC and what currently, if we get a final bill, what could end up going to the PRC?
Sure, it's a great question, Keith, and thank you for that. In fact, the Reeve Foundation going into this year was requesting level funding. But I think, in other words, $8.7 million for the National Paralysis Resource Center. The larger program, the Paralysis Resource Center program at ACL, has also for the last number of years spent about $1 million a year on a pilot program to have a state-based effort at providing grants to community-based organizations, similar to what the Reeve Foundation operates at a national level. And so one of the things that's happened over the course of this year is that with some input from us and other advocates, the Senate asked for an evaluation of the pilot program. ACL conducted an evaluation of the pilot program and has essentially decided that these activities are better carried out at the national level. And so during the course of the year, even though we went in asking for level funding, the Senate in particular has called for increasing funding for the National Paralysis Resource Center by $1 million to $9.7 million, essentially moving over that funding that was going to the state pilots to the national PRC. So I don't want you to think that they gave us more than we asked for. They love us that much, but I think it's more that in the midst of the year, the circumstances on the ground changed, and I think we are going to be the beneficiary of that should Congress finalize its appropriations in February the way we talked about. Kind of a long and convoluted answer, but I think the short answer is they're hopefully funding us for a $1 million increase next year.
Thanks for that, John. And we'll also be sending out, along with the recording after the event, we'll include lots of links to blog posts that we've written on some of these issues, or links back to some of the action alerts that we've put out that will provide some more context to a lot of these complex things that we're discussing here today. But before I jump into sort of how we plan to be advocating to Congress for things like the appropriations for the National Paralysis Resource Center or the Home and Community-Based Care Funding and Build Back Better, I wanted to take a couple minutes here and just review the efforts that we've all put in this year on these issues and some of these really impressive numbers that we have here with our grassroots advocacy team working on behalf of the Reeve Foundation. So in 2021, we've had 5,076 of our advocates have joined campaigns, sending letters and messages to Congress 8,371 times. So that's 8,371 messages this year that we've directed to offices in the House of Representatives or the United States Senate. That's roughly 700 messages a month going to Capitol Hill congressional offices from Reeve Foundation advocates talking about the issues that we advocate for, the issues that matter to the paralysis and spinal cord injury communities. And that's really great, because that means when we take that, we go that little bit further and set up meetings and request meetings with these offices, we know that we are not dropping out of the sky, for lack of a better term, that we're a group that they have heard from us before. We are regularly contacting offices about these issues. So it starts to set up that relationship that we need with these offices when we want to go in and talk in more detail about these important issues. And what were the issues that our advocates were the most responsive to this year? It would be including the paralysis community in the American Rescue Plan, which, again, as John mentioned, was a bill back in March of this year. Over the summer, we were asking for support and co-sponsors for the Air Carriers Access Amendment Act. That action alert, we had 1,101 advocates sent 1,216 messages to Capitol Hill asking for co-sponsors on that bill. And then most recently, we've had 308 advocates make 946 connections to Capitol Hill advocating for the inclusion of home care funding in the Build Back Better Act. And of all of our alerts this year, those three definitely got the most traction and the most response, and saw some of the largest wave of emails and letters being sent to the Hill on behalf of our position. Also, proudly, we're able to add 17 more regional champions to our team of regional champions through our group webinars We did one back in February of this year and then another one over the summer with our peer and family support colleagues here at Reeve. And those are really great events for letting people know about the program and getting people signed up and onboarded here to help us out with our efforts. We've also added another 1,524 new advocates to our online advocacy team, which brings our total to 9,187. And we are still trying to close out and get 10,000 online advocates by the end of the year. So as I mentioned, we'll be sharing links at the end of this webinar. I'll be sure to include the sign up, and please let your contacts know, let your network know that if they're interested in advocating for these issues or advocating on behalf of the paralysis and spinal cord injury communities in this country, that they can sign up to get our alerts from the Reeve Foundation and to take action and let their voice heard on these important issues. Moreover, what are some of our key accomplishments this year? Well, first of all, as John mentioned, the support that we got through the House Appropriations Committee and when they passed their appropriations bill in July of this year with funding for the Paralysis Resource Center, that was certainly a major accomplishment. Getting the Senate to include an extra $1 million in their language in October was a major accomplishment. And that's one area where we need to continue the pressure and continue talking to Capitol Hill about that particular issue. But for some of these other key issues that we've been working on, we have been able to see some real forward momentum on these things and things that we really count as wins here, beginning with the TBD loan forgiveness, total and permanent disability loan forgiveness program at the Department of Education. As we've communicated before, back in April, Reeve Foundation, we signed on to a letter with our coalition partners, some of our coalition partners, and had a meeting with the Department of Education to talk with them about how to reform the total and permanent disability program so that the folks who do apply and rightfully apply for that program can be more easily integrated into it and not have to deal with the overburdensome paperwork that was previously required. And we're pleased that through that effort and through the sustained effort from our coalition partners over the summer, the Department of Education did announce some major reforms to the TPD loan forgiveness program, including a data match with the Department of Social Security to automatically enroll people who are receiving Social Security benefits into the TBD program. And on top of that, they were also going to be discharging close to $6 billion in debt from people who are qualified for this program and may had been wrongfully moved out of it for reasons relating to overburdensome paperwork. So that was really great news over the summer. And we were proud to have been involved with some of our coalition partners in working on that issue. Then here in September, the RAISE Family Caregivers Council completed their important work and submitted their report on September 22nd to Congress, outlining the challenges of family caregivers, outlining the programs available to them, and making 26 recommendations to Congress on how Congress can support family caregivers in this country. And that report that was delivered on September 22nd will also be used as the foundation for what will become a national family caregiving strategy. So expect to hear more from us going forward into the new year about this issue of family caregivers and the important work that the Family Caregivers Council did to really set up a great framework for us to work with. And we have to give a big thanks to one of our very own regional champions, James Murtha from Michigan, who served on that council and put in a lot of time and a lot of energy in working on those recommendations. So we thank James for his efforts, and we thank the Caregivers Council for all the work that they did, and look forward to working with them, working with Congress in the next year on how to better support family caregivers. Then in October, some of you may remember, we got involved with more of our coalition partners, specifically a group called NCART, in supporting the Langevin and Young letter, which they issued to Chiquita Brooks-Lesor, who's the administrator of Center for Medicare services on a stalled coverage request covering complex rehab technology and things like standing seat feature wheelchairs. There's a stalled request on getting those important pieces of technology covered for people who need them. And the Langevin and Young letter was urging CMS to open that issue up and really look towards getting that complex rehab technology covered for people. And our campaign, we were able to send 690 letters to House offices asking for their members to sign on to this letter that has gone to CMS. And here to report, thankfully, the letter received 76 signatures. Again, this was something that we did with various of our coalition partners, and we know that we were kind of expecting, we were hoping to get 50 signatures. 76 signatures was well beyond what anyone thought that we were going to get. It was very exciting. We think it gives, it gives our partners and our other advocacy groups really a strong hand in communicating with CMS on this issue and helping to see that through to the end. And finally, last but not least, this was our Air Carriers Access Amendment Act work has been getting a lot of traction and a lot of attention from our online advocates. As I mentioned, over the summer, we sent 1,215 letters to the House asking members to support HR 1696, which is the bill, the Air Carriers Access Amendment Act. We are trying to gain as many co-sponsors on that bill as we can ahead of next year's FAA reauthorization bill. And so far we have 21 co-sponsors, and we want to keep up the pressure on Capitol Hill to talk to members about that important bill and seeing if they will also add their signature to the list of co-sponsors. So, this was a really great slide for me to put together because it put a lot of things in context. This has been a busy, productive year, and we've really been able to offer our voice to a variety of important issues that impact the community and really see some important results on many of them. So we're looking forward to taking these things further next year and looking for ways that we can sort of reapply the Regional Champions program to be most effective in advocating for these still ongoing issues.
Chris, could I just add one thing that I think is a great update? As a result of all the activity around the CRT letter, the coalition of which Reeve Foundation is a member, including some of our advocates who utilize that technology, were granted a meeting with the head of Medicare services on December 22nd. So we're really thrilled, and I know that was a direct result of all the activity from our advocates urging their members to sign that letter. So I just wanted to provide that update, and we'll hopefully early next year have some more good news after that meeting.
Thank you, Kim. Thank you for adding that. Yeah, that's a really, really important point and really great news. And I think, again, sort of speaks to, as we're advocating on behalf of these issues, sort of the layered messages, we can offer our perspective and our priorities, through letters, then take it to meetings and sort of let things build that way. So it's important that we get involved when we can in each step of this process, and specifically around our push for the home and community-based services funding in the Build Back Better Act. This is a great example of that in practice. So we were able to, I mentioned this was one of our three best performing campaigns with our online advocates this year. 388 advocates were able to send 1,209 emails to the Hill, asking that the $150 billion that was ultimately included in the House passed bill stay intact, and that senators are willing to support that $150 billion in the final version of Build Back Better. And we were able to take the momentum started by that letter writing campaign, and we actually had a really great meeting with Senator Kristen Sinema's office, one of our great advocates and regional champions, Mark Willits, out of Arizona. Him and I were able to have a meeting with not only Senator Sinema's staff, but also Senator Kelly's staff. But we know that Senator Sinema is an important player in these negotiations, We had a great meeting with her staff. They reiterated to us that not only was passing Build Back Better a huge priority for the senator, but that including the 150 billion figure in the final version was also a major priority for hers, and how she's been working behind the scenes with other senators to ensure that funding stays in there. So that was really great for us to hear, but we were also just really excited to be able to get a meeting with her staff. And like I said, continue that momentum that we get from sending letters and emails to the Hill into an actual online meeting with members where we could have an advocate tell their story and speak to the importance of this type of investment in their life and in the life of others in their state. So we want to continue that momentum. We, as John mentioned, the Build Back Better Act is now squarely in the hands of the Senate. So we expect us to retarget our action alert to senators, asking them specifically to support that 150 billion provision, which we're going to send out. And we urge everyone on this call, if you're able to meet with your senator or their staff and ask them point blank specifically if they will support the House version of Build Back Better, including the $150 billion for home care. That's our upcoming priority as we close out 2021. So keep that in mind. That's what we want to do around HCBS funding. And then, as John mentioned, sort of one of the other major priorities for us that's still not finished yet is FY22 appropriations. And John went over some of the, how things have progressed in Congress around this issue. But for us, our advocacy efforts, to recap, over the summer, we sent 567 emails to House offices, specifically asking them to support the funding for the Department of Health and Human Services, which also included the funding for the Paralysis Resource Center. John mentioned the update of the Senate language includes more funding for the PRC, and we have a blog explaining sort of how that happened, which we're going to be happy to share with everyone after the webinar. And we are now focused on urging that Congress accept that higher figure from the Senate language. So we expect action. As Nancy Pelosi also signaled this sometime last week in a press conference, they have until February 18th, but she said that she was adamant on getting her caucus together and accomplishing FY22 appropriations before that date. So be on the alert, check your inboxes for action alerts from us about reaching out to Congress and supporting the higher funding for the PRC, setting up members with your representatives, in the House or your senators. Particularly, we want everyone to meet with their members regardless of party, but if you know that you live in a Republican district, you have a Republican senator, or you have a Republican member of the House, we think we've communicated a lot of these issues to Democratic members. We could probably do a bit of a better job at reaching out to those Republican members and letting them know exactly how important this would be to fund the PRC. So if you know that you have a Republican member of the House or Republican senator and you're willing to set up a meeting, please reach out to me and I will help you do that. And then further look ahead into 2022, as I mentioned, we really want to take advantage of the great work that we did this year and reapply ourselves and try to get the most out of our Regional Champions program as we possibly can. So we're thinking about ways in which a Regional Champions program can allow all of you dedicated advocates to take more ownership over the issues that mean the most to you. If you know that you have a particular expertise in air travel or issues around air travel, or you know that your member sits on the Transportation Committee and you want to focus more on our work with Air Care's Access Amendment Act, let me know. Working more collaboratively with other regional champions, on things like appropriations, or just having the space with other regional champions to meet and have sort of a social hour, getting to know everyone. These are all things that we want to start to implement in 2022 to get the most out of our program. So upcoming, be on the lookout for an issue survey that I am going to share with everyone, just to try to get a better sense and learn more about the issues that you care about, the issues that you feel you have the strongest handle over, what you might want to learn more about. And then we're going to try to implement something which I'm calling the dream team, where we can start to get folks in our regional champions program working more specifically with one another and on these issues in conjunction with me and the rest of the Reeve Foundation, to try to bring more expertise into these meetings and help us all work more collaboratively on these issues. We're going to implement some monthly happy hours in 2022, so we can all get a chance to know one another a little better. And we are excited we're going to be offering an advocacy summit. The date is to be determined, but we are really looking forward to that sometime late in 2022. And as the pandemic starts to wane, and thankfully I was able to get my booster shot early this morning, so I'm looking forward to getting out into the country and traveling and doing some regional advocacy trainings in local communities. So if you know of a location, or you think that your local community is one where you have some people that would be ripe for joining our regional champions program, I would definitely love all the feedback I can get from our current regional champions on where an advocacy training may be a good place to start. So that's 2022. So I'll end with just an enormous thank you to all of you. We've had such a great year, and we could not have done it without all of you here with joining us live, and to all of you that are going to hear this on recording later on. I just really want to thank you for your commitment, for your responsiveness. Whenever I have a question about a new issue that's come up and I reach out to the regional champions, I'm always getting such productive feedback, and for your tenacity. You all stay with us. You respond to our action alerts. You're willing to get involved when we need to have an important meeting with someone on Capitol Hill. We really thank you for all of your focus, all of your efforts. You make the job fun. So it's an honor to get to work with you all every day. And thank you for joining us on this last webinar of 2021. And we'll open it up to questions.
Thank you so much, Chris, and thank you for all your efforts this year in really expanding our regional champions program. And I really look forward to working with you, and of course Waxman and all of our amazing advocates next year. I'm looking at the Q&A box here, and I don't have any questions. If anyone who's attending right now would like to submit one, feel free. I do want to acknowledge a few questions that were submitted before the webinar, and some individuals were inquiring about advice around seeking employment with a disability. And then there was also a question around accessing assistance and advice. It looks like there is an advocate who is spending a lot of time caring for their son who is quadriplegic, and we would love to assist you if you're able to reach out to our resource center. So I'm hoping that Kaylee could just throw in the chat box our information to contact us directly to our information specialists. And if you're unable, thank you very much, Kaylee. We would love to try to assist you with those two items. So I think, and of course, reach out to Chris directly if you're unable to reach us through phone. And I think that's it. So if there are no other questions, please look out for the follow-up information from Chris. I wish all of you a very healthy and happy holiday season. And we really look forward to next year. And thank you again for all your efforts. Take care.